Yeah, welcome to the reproductive health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi. Like we promised last week, we are continuing the laboratory, and we're going to be we're looking at how laser assisted hatching is done. And so I'm going to take you to Mr. Leke Fasasi to tell us and show us how this is done. How are you today, Leke?
I'm fine, I'm good.
Good. Can you tell us about this equipment, this beautiful equipment, and tell us how you do this laser assisted hatching?
This machine is the intracytoplasmic sperm injection machine, or injecting the sperm into an egg of a woman. And the topic we'll be treating today is the laser assisted hatching. Is one of the accessories of the machine, which is the red knob here. This is what we use in creating a zone of weakness.
Okay. Can you show us how you do this? I can see that you're already showing us. Let me ask a question. Is this an embryo that you're showing?
Oh, no.
Okay.
This is just for a demo.
Okay.
It's a human egg.
Okay.
Which is just for demonstration.
Okay. But the egg also has the zona pellucida, which is what you trim off in laser assisted hatching. Can you show us how you do this?
Basically, the egg in view is the egg from a woman, which is definitely going to develop to an embryo. So the covering of the egg is chopped off bit by bit to create a zone of weakness on the embryo, which will help hatching and implantation in the woman on transfer. During laser hatching, you come to this red knob here, and with calculated power, a shot is made on the covering of the egg, and from there, the part is chopped off.
Yeah, I can see the chopping off. Can you do that again? Maybe our viewers will be able to catch you.
Okay, I'm going to move to another, because that place is already chopped off.
Yes.
So I'm going to move to another area that has not been touched, and from there, we can fire, and I come again, it's off.
Okay. Now, if I get you right, you said before your transfer, before you do the transfer.
Before embryo transfer.
Okay. Is there any particular day that this can be done? I mean, do you do it for instance, of blastocyst?
Oh, no.
Okay.
Laser assisted hatching is limited to embryos on the 3 after egg retrieval from the woman.
Okay.
In the theater.
Okay. We said a few weeks ago, we talked about the indications for laser assisted hatching, and we said it involves women over 37, that people who have had repeated implantation failures. We mentioned even people who have high basal FSH level. Yeah, we mentioned people that you just see that the zona pellucida is thickened even in their first treatment. Yes. And also we mentioned people who are using cryopreserved eggs. Okay. So viewers, you've seen how this laser assisted hatching is done. It's a very simple procedure, and we spoke about the complications that could arise from it are mainly that the egg could be destroyed. But if the person doing it is well trained, this risk should be very minimal. We also spoke about the risk of monozygotic twinning, which is a little bit increased with this. But these are some of the things that can happen when you do laser assisted hatching. But when you look at the advantages compared with the disadvantages, especially the fact that implantation rate can be improved in this group of people that we're talking about, then you see that it's a worthwhile thing to do. Is there anything you want to tell us more about this laser assisted hatching before we end the program?
Basically, all I'm going to implore the viewers, because most times when they hear about it, it's like they never heard of it before. Okay. But definitely, all effort is geared at improving their chance of success, even at the first attempt. Okay. So where indicated, the team is going to discuss with them and tell them the benefit, and from there they should see at something that is promising for them. Okay.
And if you look at this, what we're saying is that that they're like patients whose prognosis is not particularly very bright. Yeah. So your machine is able to increase their chance.
Yeah, basically what I'm saying is it's offer more hope to people in advance. We're talking about people of age above 37, 38 years old who might insist to use their own egg if the results and findings favors them. But however, even though they are producing egg, it is known that in this group of individuals, there's a degree of rigidity on their egg covering, which needs to be removed if success is to be our core value.
Okay. So people above 37, what you're saying is that this increases their chance of having their own genetic children.
Yes, without using another woman's egg.
Fantastic, fantastic. So, viewers, I think this is at the point that we ran this part of the lab up. Next week, we're going to continue with the lab, and probably that will be the last episode in the laboratory before we move on to other things. Thank you very much for listening. See you next week.